Hello Mzansi, welcome to the World Diabetes Day initiative powered by Health for Mzansi. Now the world is experiencing a steep rise in the number of people living with diabetes. In fact, a concerning reality is that many developing countries like South Africa now face the brunt of this chronic condition. At least 11% of South African adults live with diabetes, which is the highest in Africa. In our program today, we unpack all things diabetes, from better understanding this condition to also managing it successfully. We're joined by leading experts who share their advice on dealing with diabetes. Here to tell us more and give us an official welcome, we're now joined by Health for Mzansi's publisher, Ronelle Lawrence. Ronelle, welcome.
Hi, Duncan.
You must be excited to be here today and talking about this very important...
Very, very excited. Health is really core to my existence, always has been. And to be part of the Health for Mzansi team is just fantastic.
Let's talk about Health for Mzansi. What is the publication about and what makes it so different from other health publications?
Health for Mzansi is quite different in how it delivers information, who it delivers it to, and intent. Also our connection with agriculture through Food for Mzansi. Just makes it very different in approach. We have several platforms, and each platform is approached in a different way, considering the mechanics or the way that the mindset with which that platform is used. We also recognize that health is quite personal, so we have different groups where we can address specific issues like diabetes or weight loss, for instance. So we can really meet people on their whole health journey, where they are at. Our website, we concentrate on quality journalism, and on our podcast, for instance, we look at really talking about breaking the silence on sensitive issues. And that, I think, is what makes us really unique.
Yeah, that's powerful, and I think what you've achieved as a publication in South Africa, it's truly inspirational. Tell us, every publication has its why. Why launch Health for Mzansi?
Working with Food for Mzansi, which is now South Africa's biggest agricultural publication, we often looked at the relationship between people and food systems. And besides the obvious fact that food influences your health, we realized that there is a community of people who are really underserved in terms of health information. Besides the scattered resources of the internet, the family and friends, there really wasn't a place for them to, there really wasn't a place for them to fulfill that need and really support them on their health journey.
Now, many people don't know that you won an award for being the best global Gen Z initiative. Tell us a bit about that.
The best Gen Z initiative in Africa, and that also means we are now in the running for the international award, of course. Just being just a year old, that was really the encouragement we needed to know that we are on the right track. And it's with One IFRA, the World Association of News Publishers. So we're very, very excited, and we'll let you know if how it goes with the international awards. But just attracting a young audience is difficult, and attracting a young audience on a topic such as health is, I think, pretty awesome and unusual. So we're very proud of ourselves, and we can't wait to deliver more and see where it takes us.
Yeah, it's amazing. You talk about audience, who is the publication for, and who are you hoping to reach with the content that you publish on Health for Mzansi?
Yeah, we really create our content for two specific groups. A public or consumer group on the one hand, and on the other hand, we have people within the health service industry. Now, the public group, we also have people with two specific reasons they are interested in health. On the one hand, there are people who are interested in the health information or betterment, because either they or somebody within their family or friend circle have been diagnosed. So at a young age, they've become aware of the risks and implications of illness. But there are also people who are interested in health and fitness because it's part of their identity and their status.
Yeah.
And like I said, the other main group would be people within the health service industry, as we speak about it. And they are really enthusiastic about their work. They want to improve their knowledge, but they also enjoy the recognition of their peers. What is interesting, that across all the platforms and all these groups, the main group that reads or enjoys the content are women between the ages of 25 and 30. And the group just slightly behind them, you can actually put them into one group, are women 30 to 35. So we're really reaching a young audience, which is brilliant.
Well, there you have it. That's Ronelle Lawrence, the publisher for Health for Mzansi. If you didn't know about the publication, now you know. Make sure that you visit www.healthformzansi.co.za. We now switch gears to our keynote speaker, Damaris Kivitz, who is a health activist as well as a community liaison officer at the University of the Western Cape. Damaris, thank you so much for joining us and for being here on the session.
Thank you for having me, and especially if we talk about this critical topic that we're about to address.
Yeah. Tell us about this critical topic. It's diabetes. What does that mean for you, and what can you share with our listeners?
I think for me, firstly, as an individual and as a person being at risk of contracting diabetes, because I have a genetic diabetes history of my late granny, my father, and in my father's family, there's a history of diabetes. So 10 years ago, I made a conscious decision of making the mind shift of living healthy. Yeah. And I think a healthy lifestyle doesn't mean a doomed lifestyle. So you can choose what is healthy for you, what is wellness for you. It depends entirely up to you as the individual of how you portray yourself to live healthy, and especially with diabetes. Because you get two different types of diabetes. You get the type 1, that's no cure. Type 2, there is a cure. But also diabetes is something that is manageable. Diabetes is something that you as the individual can control. Yeah. However, you would see in communities, and I've seen it often, is that people with diabetes are the ones that would go for a chocolate. It's one that would go for the fizzy drinks, so everything that should not be done.
It's difficult to resist chocolate though.
But having a chocolate now and then, I don't think it's a challenge. But it is when you indulge. It's like alcohol, it's not really harmful. But it's when you indulge in that alcohol, when you go into a stupor because thereof. And the same around diabetes, you can manage your lifestyle. It's something you can control if you have made a conscious decision that is what you're going to do. You're going to control it, you're going to manage it, you are going to adapt from where I previously didn't need to watch what I'm eating. Now I actually need to make sure that I watch what I'm eating. I need to make sure that I don't overindulge in alcohol. Alcohol and diabetes are not very compatible, you know. So, and those are the choices that you as an individual needs to make. But I also think the importance around children living with diabetes, because that is many times something that we don't really speak to. Because children living with diabetes are ordinary children. It's like a child living with disability.
Yeah.
There's nothing wrong with that child. That child just have a challenge that the child needs to adapt to, and the family needs to live with that challenge. The same around diabetes is, how do we adapt once you are being diagnosed? And I think it gets you to the acceptance of your diagnosis. If you don't accept your diagnosis, you are going to live recklessly, you're going to make as if you don't have diabetes, and so you're going to go into a coma more than once because you're not going to drink your meds, you're not going to live as you should live healthy, because you can still live healthy with any chronic disease. You can still live healthy being a diabetic. It is taking care of yourself. You know, it's like in the previous session, somebody said, love yourself enough to take care of yourself. And that would be my key message, is love yourself enough to adapt to a wellness lifestyle. And when I talk about wellness, it's not just eating healthy, exercising, but you must also be spiritually, you need to be healthy, because if you are intact with yourself, then diabetes is not going to be a death sentence, because it's not a death sentence. You know, it's a diagnosis, and how do you accept the diagnosis, and how do you live with the diagnosis? A lot of people say, you know what, living with diabetes is so expensive and everything is expensive. Life has become very expensive. You can see the food basket has increased with between 12 to 15% since, say, 6 months, 3 months ago. And so, you know, living healthy, what does that mean for a family that lives on a social grant?
True.
So I think for a lot of diabetics, the challenge currently is that they cannot make ends meet. And so living with diabetes on a social grant, you ask yourself, what gets preference?
How is that even possible?
What gets preference, you know? Bread is expensive, but yet bread is possibly one of the main sources that people can afford. So, and bread is one of the things that living with diabetes is not something that your body wants constantly. So your body wants a balanced meal, your body wants an adjustment of fats, it wants an adjustment of your rainbow foods, you know. And so even that, carrots used to be cheap. Nothing is cheap any longer, but it's how do you find a way of making sure that you want to live healthy. And also, like somebody said previously, we would easily say we would die for our families. So why don't we live for our families? And I think living for our families is ensuring that when there is a diagnosis within the family, that we as a family actually support what is happening. Because a lifestyle change means that we as a family is going to have a lifestyle change. Because if I've been diagnosed with diabetes, it means that in my generational line, one of my children or my grandchildren can basically pick up the disease along the way. So the lifestyle change starts with me, but it also needs to have that ripple effect down with my family. And for many families, that is not the case. You know, you will see in families, you are diabetic, so you get almost a diabetic plate. You know, you are treated differently than the rest of the family. So why don't we just treat everyone the same? Because the changes are not that harsh. It's just that you need to make sure you eat your portions correctly, your body generates enough insulin so that you can keep going during the day.
Yeah. And how important is that, having that support from your family side in terms of all of a sudden how I consume food and what I consume changes? How important is having that support from your family in making those food choices?
It's of critical importance, because if you have the family support, you're not alone. And if you have the family support, you also know it's almost like you have cheerleaders.
Yeah.
You can do this because we're going to do this together. But if you have a family that, no, it's her thing, she's been diagnosed, I haven't been diagnosed, so why should I make the changes on her behalf? Mm-hmm. But if we say, because we are family, this affects all of us, we are actually going to do this together, then it, like I said, it's like you cheering that person on to live healthy, to make the conscious decision around his or her own wellness.
Yeah, that's
so that is what is important.
Yeah. There you have it. That's Damaris Kivitz, a community health activist as well as a community liaison officer at the University of Western Cape, sharing her advice and tips with dealing with diabetes.
Well, Dumelang Mzansi, Dumelang Duncan, and Dumelang to our panel of experts. Welcome to our first ever panel discussion on diabetes. So just a bit about what Health for Mzansi is from my side. So Health for Mzansi, it's a Kasi health and wellness publication where we unpack big topics and give local perspective, which is what brings you ladies here. And on our agenda today, we will be tackling a very heavy topic, which is diabetes management and coming to terms with diagnosis. So our experts on our panel are practitioners across the health industry and are here to share their insights and advice. First up, can we do some introductions? Starting with the clinical manager of health services in the Department of Health in Drakensberg.
Hi, good morning. I'm Dr. Rushan Gafoor. I'm a clinical manager of Drakensberg Department of Health. I'm a medical doctor by profession, and I'm a person living with diabetes myself. I'm a type 1 diabetic, and my husband is type 2 diabetic. So we live the diabetic lifestyle.
Mm-hmm. And over to you, Lynn.
I'm Lynn McCullum. I'm a nutritionist and health coach based in this area.
Okay. And
I'm Olivia Losper, a personal trainer, entrepreneur, and I've got a fitness studio in Paarl. Yeah, I like to get my community moving. I feel like that's my biggest job.
And I'm Damaris Kivitz. I'm a community liaison officer at the University of the Western Cape. However, I'm here in my capacity as a health activist.
Okay, thank you so much for those introductions, ladies. I think we'll go into our questions then, starting with you, Dr. Gafoor. When we think of diabetes, we don't think of somebody who is young that would be affected by it. Who is most at risk for the disease, and how can you prevent it?
So let me start off with just saying that diabetes is one of the most leading causes of death in South Africa, and of late it has increased, the prevalence has increased exponentially, and that is because of lifestyle. So at risk, before we go to who's at risk, let me just break down the different types of diabetes that you do get. So firstly, you get gestational diabetes, which occurs during pregnancy, and that is usually temporary, so it disappears after pregnancy. But if you do have gestational diabetes, then you are at risk of developing diabetes later in life, even though it disappears after the pregnancy. And then the two types that are more prevalent are obviously your type 1 and type 2 diabetes. Type 1 diabetes is usually found in children and in younger people, but more frequently they've been diagnosing type 1 diabetes in older people as well. So type 1 diabetes is when your own immune system attacks and destroys certain cells in your pancreas which produce insulin, so your body has either too little insulin or no insulin at all. And unfortunately, type 1 diabetes is not preventable. And then type 2 diabetes, which makes up 90% of diabetes, is your diabetes of lifestyle. So you will find it more commonly amongst older people, overweight people, and this is the type that you can potentially prevent. So your risk factors then for type 2 diabetes would be weight. So if you're obese or overweight, age, so older than 45, if you have a family history of diabetes, and then lifestyle. So if your diet is not healthy or you live an inactive lifestyle as well.
Okay. And then for our next question, we can move over to you, Lynn. Can you tell us, why do we need to as Dr. Kafur just emphasized, healthy lifestyle? Why do we need to develop a healthy eating plan? I mean, I've been talking to experts across the board who have told me that lifestyle changes are bigger than exercise and what you eat. It's more of a mindset. Can you tell us then, how do you psychologically come to terms with the fact that, you have to make these big changes in your life after diagnosis?
Well, a chronic illness diagnosis is never easy to take on. So it is a process, and always recommended to get support, to get a professional to support you through that process, to deal with the mindset, to put a plan in place. Always being prepared will get us better results. And then, to have the mindset as well that if we look at epigenetics, the power really lies more in our lifestyle, and that brings the power back to us. So to look at ways that we can adjust our lifestyle then empowers us to deal with the diagnosis.
I'd like to get some health activist insights from you, Damaris. Let's talk about diabetes management in our Kasi communities, in our lower township communities. How is, can you give us some perspectives in terms of how is it managed, or how is our system basically managing diabetes diabetes prevalence well in our communities?
I don't think so, because food is expensive. And if you look at the lifestyle change, and you look at the kind of food that, say, a child needs to eat, if you look at your free veggies, is your broccoli and your green veggies, it's expensive. So if you need to provide that child with a balanced plate, it's not going to cost you under 100 Rand. And for many children, you take a child that's on a care dependency grant, 450 Rand. That 450 Rand for a child living with diabetes is finished in 2 days. And we see it in hospitals. We see the income of young children in hospitals, because their lifestyle hasn't been adapted, as well as their eating pattern. It's bread in the morning, it's bread in the afternoon, it's bread at night. And so that child is challenged by the fact that how do I, and I've seen it in children, because I recently had a young girl living with me, living with diabetes. I could afford to have her lifestyle changed, because I'm on the brink of diabetes because of a generic family history with diabetes. So my lifestyle has changed 10 years ago. So I eat a low GI, my head has shifted. And so for children also, making the shift of a 50 cents packet of chips that the mom would give for breakfast or for lunch or for supper. It's out. But it's difficult because parents just say, I can't afford it.
It's a terrible economy to exist in. It's undignified and stuff, yeah, it really is. And then maybe we can move over to you, Olivia, and so you can give us some fitness guidance. So if you've got diabetes, you're always wanting to keep blood sugar under control. What should diabetics consider in terms of timing of their workouts and getting active and stuff?
Getting active is crucial. Firstly, you need to find something that you love, something that you actually enjoy, and not to compare yourself with anybody else, because if Zumba works for you, it doesn't necessarily work for me. So, most important factor, find something you love. For some people, it's literally putting on the music and dancing for 20 minutes. Simple. And then secondly, our exercise is a stress release, and it helps us cope with things like living with diabetes. So just to get the strong mind, and you can be a strong person, but you need those daily things that you do that makes you feel strong and good, and exercise is that. Excuse me. And then exercise helps our bodies. It makes our bodies more sensitive to insulin, and insulin helps your body use your food for energy. So you'll actually be helping the process if you work out consistently, regularly, with diabetes and trying to prevent diabetes, basically.
And over, like, I've always wondered, for you, Lynn, maybe, I've always wondered about plant-based diets. They are obviously high in the trends, and everybody's eating a seed butter or drinking a seed milk. How can plant-based diets possibly maybe even prevent or help diabetes management?
It's a really interesting question, and research is indicating that they can very much help and prevent diabetes. The thing we need to just be aware of is not to go too high in our saturated fats, and your omega-6s as well, which cause an inflammatory response in the body. So rather choose your omega-3s over your omega-6s. And examples of omega-3s are your fish, chia seeds, flax seeds. So stick to your omega-3s. And then obviously eat the rainbow diet, as much fruit and veg as you can. I like to advise my clients to break it up throughout the day, so have 1 fruit or veg for breakfast, 2 with your lunch, and 3 for dinner, and then you'll be getting in your plant-based foods throughout the day. So
Okay. And what is the rainbow diet? When I think of rainbow, I think of 7 colors with the beetroot and the potato salad and that kind of thing.
That's it. It's an easy way to actually make it applicable. And the days of counting calories, thank goodness, are over. And any extreme diets, really, I don't recommend. But if we come to eating the rainbow, it's an easy way of saying, well, I've covered my red foods for breakfast and my green foods at lunch. So to use that as a guidance throughout the day to eat the rainbow. The rainbow foods are rich in phytochemicals as well, and provide all those wonderful nutrients. They will balance blood sugar levels, so keep you off your roller coaster.
It makes eating sound fun.
Yes, it should
And
be.
remember, we are used to rice, potatoes, and piece of chicken or something. So basically, it's all in the same color. If you think about it,
Yeah.
yes. So it's just about having different colors on your plates.
I love it. Oh my gosh. And then maybe back to you, Dr. Gafoor. What are some steps you can take to manage diabetes? Say now you've been diagnosed, what's next for you in your journey?
Okay, so very important is education and empowerment. So you need to know your diagnosis. You need to know what's happening to empower yourself and to be able to take responsibility of your health and your condition. So ask the questions to make you understand your diagnosis as well as your treatment plan. And once you are aware of your diagnosis and you understand, then you can say, these are the steps that I need to follow to keep my condition under control. So it's diet. Am I eating the right foods? Is my diet balanced? You know, keep your sugar and carb laden meals to a minimum, or foodstuff to a minimum. Exercise regularly, as Olivia has mentioned. Exercise does increase your insulin sensitivity as well. Avoid alcohol or too much alcohol, and stop smoking. Even better, don't start smoking to our younger generation. And then the given stuff, example, take your medication as prescribed with a meal. There's a lot of support out there as well. So if you do feel overwhelmed and you feel anxious about managing your condition, reach out for help. There's support in terms of your healthcare worker, family and friends. And in today's day and age, with all the social media available, you have so many forums and so many groups that can provide essential insight into your condition, as well as the support that you need. So there's a lot of resources available, but to me, key is that you empower yourself on managing your condition and draw on whatever resources are available around you.
When you said the drinking thing, we're heading into December, and South Africans are a nation of drinkers.
So alcohol can wreak havoc with your sugar control as well. And I recently was involved in the care of a patient, type 1 diabetic, elderly lady already, where they were socializing, and she had a bit too much to drink. And her sugar levels dropped in her sleep, and she did a brain injury. She developed a brain injury because of a hypoglycemic episode, but because she was intoxicated, she wasn't aware also of what was happening. So I think that often our community, they don't understand the full impact of alcohol. They just think alcohol is bad for you, for your liver, but it's beyond just what alcohol does short term to a person.
It's way bigger.
And just on what doctors are saying, it's the same with your younger person and that late night snack. So now they drink, they don't take that late night snack. It happens in the sleep, they don't wake up, you know. The family, and I think that is where the community and families play such a critical role, because I'm a granny, but I'm also a mother. So I keep watch all the time, whether my grandchildren has diabetes or not diabetes. I know we're at risk. So as families, we need to look at what is in the best interest of our family members. And if you know that you are a family at risk, if you know you have a family member living with diabetes, then make sure you understand the diagnosis, as doctor says, and that you understand the treatment. It's almost like becoming part of a social club. You know, can we exercise together as a family? Do we eat healthy together as a family? Do we take each other's well-being ours as a family and as a family community?
Oh, that is so powerful.
And that's, you know, we're bringing up the next generation in that family environment. That's where we want to educate the next generation in preventing diabetes, passing it further down.
Because they watch what we do and they do that.
So lifestyle change is so much easier if everyone is on board and we do it together as a family or as a community or as a friendship group. But also if you are diabetic, then obviously your children are also at higher risk of becoming diabetic. So if you can instill that already at a younger age, you are potentially preventing what is to come.
You're changing the generations.
Yes.
And I often hear people say, and with the show I'm doing, I use it a lot. Because I often hear people say, I would die for my family. So I often ask people, so why not live for them? If you would die for them, why not invest in yourself daily so that you can be here for the wedding or the whatever big celebrations are coming up? We have to live for each other, and it's not selfish to take care of yourself, because you're going to be a better wife, a better mom, in everything you do, you're going to be better. So if you come from that and work from that, eat from that, exercise from that point and that focus, you will be successful. And it's absolutely manageable. Look at us, you're stunning.
Yes,
She looks lovely.
Thank
It's
you.
absolutely manageable. You just have to do it consistently. And you guys spoke about the alcohol now. Yes, there's massive effects, but day to day it affects us, because now late night you're going to drive to KFC because you're making poor decisions because you had some drinks. And then also tomorrow morning, I'm a bit hungover, I'm not going to feel like working out. It's a ripple effect. It's not just that night.
And you want your hot wings the next day.
I'm telling you. You cannot argue with your drunk self. You don't lose.
And then maybe back to you, Liv, and also you can also jump in here, Lynn. Can you guys maybe share some tips regarding movement on your side, and then meal prep tips, guys?
When it comes to movement, as I said earlier, it's very important to find something that you love. You cannot work out solely to manage your diabetes or work out solely to lose weight. It's not going to be motivation for long enough. So you're going to have to find your why and go with it. You must remember every day, I'm doing this because I want to be here when my child graduates. It's a daily choice. Every day you have to wake up and decide, why am I doing it? And why is it still worth it? And focus on how you feel, how much lighter you feel, how much more energy you have, how much better you sleep. And if you focus on that, you're going to want to do it more, because I've got a good night's rest and I feel good, I feel positive. Self-confidence is a big thing. And keep pushing for that. Forget about the scale, forget about everything else, because once we start taking care of ourselves from a place of love, our bodies will respond. I mean, we are so hard on ourselves. We talk down to ourselves daily. And if speaking kindly to plants helps them grow, I mean, what would happen if you looked in the mirror and said, girl, you got this. You can do this. Yeah. So change the self-talk. Like, change what happens here, because what happens here plays out in our lives. And we are our own worst enemies sometimes. So get out of your own way and start loving yourself. Stop saying, I'm going to love myself when I get to 50 kilograms. I'm going to be so much happier when I fit in my size, whatever. Life doesn't work like this. If you don't love yourself now, I'm telling you, you're not going to love yourself minus 50 whatever kilograms.
Yes, I love that. Love yourself with no conditions. Yeah. Must be unconditional love.
Absolutely.
That you give to whoever, you must also give to yourself.
Absolutely.
And then maybe you, Lynn, can hop in on the meal prep.
Yes, so actually a really great way to practice that self-love is to start with a meal prep. And to put a plan in place, do some research, speak to a professional, and choose some recipes for the week ahead, do the shopping for those recipes. Something like overnight oats is really great, with some berries. Easy, 5 minutes to prepare, and it's portable. You can take it to work in the morning. A nice salad with some protein. Always include protein and some form of fat as well. It helps to keep those blood sugar levels stable. And choose smart carbs as well. So avoid the processed foods. Smart carbs, the examples that I prefer: sweet potatoes, brown rice, quinoa, and small portions of that. Have your protein as well, and then all your rainbow foods that you can add in as much colour as possible. So those are my meal tip preps.
If I could add to that as well, avoid your sugary drinks and juice. I don't think we realize how much sugar is in juice. We naturally associate juice with fresh fruit and vegetables. It's not the same. So rather increase your water intake. I think we don't drink enough water as well. And then obviously decrease the amount of sugar, and simple carbs that you take in to a minimum. So keep it to a minimum. Small changes will make a massive difference. Yes.
And when it comes to food also, I often hear clients complaining about the time it takes to prep and the time and the time. So this is going to be a lifestyle. What will work? For some people, I say, make bigger portions at night. You can use half of it for lunch tomorrow. Try to make things simple. Stop overcomplicating everything. And I mean, literally, oats is the best breakfast, by far. It's not that expensive. We can do oats. So if you know bread is something that you guys eat in the household every day, try to skip it for breakfast and have your oats. So we also have to work with, we're all on a budget. We have to work with what we've got. And when it comes to we all need fish, and my clients often complain about these things. This is expensive, that is expensive. Canned. If you can't do the raw fish or whatever, try canned. It's still good sources, eh?
And if you do eat carbs, if you are forced to have bread, then rather have your whole wheat bread over white bread. You get whole grain or whole wheat pasta as well over white pasta. So it's just making conscious choices and decisions. You don't have to be that limited. If you have rice, have brown rice rather than having white rice.
So every day just think, how can I make this meal healthier? And do it.
And more colourful.
More colourful.
It's all about the color.
We need colour in our lives.
And then maybe just the last question to you, Tamaris. In the Dr. Kafour just mentioned that there are educational resources out there. Where can people actually access them? In terms of managing your diabetes disease and stuff.
Very good question. I asked somebody yesterday, because as you can see, I've got on blue. It's not the blue for diabetes, because the blue for diabetes is light blue. So I said, what ribbon? Now, I also do lipsticks. It's easy in my bag. But I think education is of great importance. And for me, the challenge with the Department of Health, I can't speak to another department, I need to speak to them, is the fact that the health educators that we had at our facilities, they're not there. So if we really want to make sure that services are at the primary health care level, because that is where it starts, then we need to make sure that our education starts at the primary health care level. The department introduced the club system. I can remember back in the day it worked because we had dedicated people in the club system. We had a sister that is passionate about diabetes, so she would get all her resources ready when it's club day. I can remember when I used to work at Delft, it was on a Thursday. I always looked forward to a Thursday because she's going to treat her diabetic patients with something new, something fresh. And so for me, we need to get back to a department that's inclusive. And if I talk about inclusive, I'm talking about identifying your champions willing to live that difference. Because amongst the staff, you do get people that is passionate about people living with diabetes. You have people passionate living, people educating people living with heart disease. And so identify those champions, make sure the club system is effective, that it runs, it works. And for me, I think research has shown that if people are kept abreast with information, they would be able to adapt, because an informed person is a person that makes the right choice at the right time. Uninformed people, and you see it in our communities, you see it when most of the children at the moment in a ward in a specific hospital is from an underprivileged community. Now you ask yourself, was the education given? What is the lack in the community? What is it that we need to do to trace back the cycle of why we have defaulting children living with diabetes in hospital at the moment? And I think that's the kind of partnerships that we need to look at when it comes to community education, because it does, and the department loves saying it, the MEC loves saying it, it's the whole of society. What is the whole of society if you exclude critical voices in your community? Then you're not taking the whole of society with. And it's like I told you earlier, I've been to the States. They have a diabetic health club. I was shocked that I didn't see coffee. It's a choice of that group of people. But the children come in, they get to talk about diabetes and wellness and exercise. Then all of us get water and we go on a walk, and it's water, it's not the energy drinks, it's not the fizzy drinks and all of that, it's your bottle of water. And so in this club you have the physician, you have the dietitian, you have the physiotherapist, you have the occupational health therapist, you have the community member that is a role model to the community. And I think we need to look at what is going to work for our communities and how can we reduce the burden on our health system, because currently we have a burden on the health system because communities are not informed. Or if they are informed, how do we as champions, as activists, zoom in on that community? I mean, I worked in Delft for years and I saw the interventions we could do collectively. Now, I don't know what we're doing wrong or right, because the burden on the health system, and especially people with chronic disease, it is something else.
It is something else. Let's start with you, Dr. Gafoor. Last comments after Tamaris' Amandla moment.
So as I mentioned before, key to managing your health and wellness is that you are well educated, as Damaris has also said. Empower yourself, take responsibility, follow up, go for regular checkups and attend your appointments and follow-ups. I think Damaris will also be able to indicate that in the community the default rate is quite high. So if you do take interest in your health and your wellness, you should be attending your facility, your clinic, your GP, your physician, and go for your checkups. Yeah, diabetes is something, as we mentioned, is preventable. It's something manageable. Take control. And we don't, there's, which we haven't even touched on, about all the potential dire complications of diabetes, like heart disease and stroke and kidney problems and blindness. But if you manage your diabetes, you won't have to be there. And quality of life is important. I think a lot of our people have the this false idea that life on earth is an eye blink anyway. So I'm going to die anyway. Why not just enjoy life and do as I please? But the reality is quality of life. You don't want to be sitting without legs or blind or stroke bedridden. As Olivia's also mentioned, you mentioned that I will do anything for my family. So to be able to give your family the best, you need to be the best. Yes, that's my advice.
That's a beautiful closing point. You must chop life cautiously. Yes. And from you, Lynn?
I think mine would be to figure out your why. Why do you want to make these changes? What matters for you? And that going after that quality of life and maintaining your independence. And then from the food side, I'd like to get creative with food. Food really is there's so much potential with food, and it doesn't have to be boring, and it doesn't have to be expensive. There are ways, and that's to use your creativity and find ways that you can make it work for you. And whether that's research or to educate yourself, get on the internet, seek professional guidance, but put that plan in place and get that meal prep going and get creative in the kitchen.
It's your rainbow.
It's your rainbow.
And from you, Olivia, last.
Oh, one thing. Just start loving yourself. It sounds so simple, but we are so broken, and we are where we are because we've got a lot of hurt people out here, and hurt people hurt people. So start loving yourself, because we take care of the things that we love. So when you start loving yourself, you will eat better and exercise and do things because you know it's good for you. Yeah, that's it. Love yourself, man. It's so simple, but there's so many people that is their own, like I said earlier, worst enemy, and they self-sabotage, and the negative talk just continues every day, and we just cannot expect to have a good life with a negative mindset. So just, even in the beginning, if you don't believe yourself, stand in the mirror, say it every morning. I promise you, eventually you're going to start believing it. Eventually you're going to start living it. But you have to focus every day and start fresh and decide, I'm going to work on it. I'm going to invest in me, because I love myself.
I was so nervous about this panel discussion, and my mom said, do your affirmations, babes.
Yeah, oh, yes, girl, you have to. And I mean, it's so simple, no? But it helps.
Yeah,
it helps. And every time you do it, it gets easier to do it. And literally later, it just spills over into everything else in your life.
It does. Thank you. And from you, Damaris?
Well, I'm going to latch on to Olivia.
Okay, of course.
Love yourself enough to eat healthy, sleep healthy, and work out healthy.
Oh, thank you so much. Thank you so much.
And if I can encourage everyone to wear a splash of blue or blue in the month of November, just to show your support towards Diabetes Awareness Month for November. And I think there are much more people than we are aware of that are living with diabetes. So if you do know of anyone, show them that support, because they might be going through a difficult time. So if they know they're not alone, you might be making a huge difference to someone else.
And also, if you know somebody is struggling financially, buy the free veggies. That is not that expensive. It will assist the person living with diabetes.
Okay. Thank you so much, ladies, for joining us. And this was a very action-packed conversation. And I hope whoever is watching can, gain some value from the insights you guys have shared with us. Health for Mzansi is WhatsApp official. At Health for Mzansi, we put people first. So we have created a safe space where you can get access to our latest health features and be part of a health community. Join our Health Squad or Health Heroes group for more information. Don't forget to follow us on social media.